Thank you, Don and Ilan, for wonderful talks. And we'll go on to the third part, which will be discussing radiofrequency-based therapy. And I'm going to be discussing the Vertica and the VerticaPro. As the break is starting, it's louder. So can you guys still hear me pretty well right now? All right, great. All right, here are my disclosures of note. I'm the principal investigator for the Vertica device in the US. So what is the Vertica device? It is a non-invasive handheld radiofrequency device designed for the treatment of erectile dysfunction. It delivers controlled radiofrequency energy to the penile tissues. It is intended to improve erectile function by enhancing cavernous tissue health and neurovascular signaling. And it is used in an outpatient office-based setting and does not require anesthesia, injections, or surgery. So the indications in the target population are men with mild to moderate erectile dysfunction, patients with vasculogenic or neurogenic components of ED, particularly relevant to patients who prefer non-pharmacologic therapies, and can be considered in patients with suboptimal response or intolerance to PDE5 inhibitors like Don discussed. And it has been investigated as a restorative therapy more than purely symptomatic therapy. So here are the device components and design. And again, if you go to the booth, you'll be able to see an example of it. It's a handheld generator with integrated radiofrequency source. It has an ergonomic design which allows precise application along the penile shaft and the glans. It has built-in safety features to control energy delivery and temperature, and it has pre-programmed treatment parameters to standardize therapy. So it delivers low intensity radiofrequency energy to penile tissue, which, as Elon discussed, induces controlled thermal effects to the at the tissue level, promotes increased blood flow and improved endothelial function, simulates nerve regeneration and tissue remodeling, and aims to enhance smooth muscle relaxation and cavernous responsiveness. And you can see here some of the demonstrations about how the device is applied on the animation on the right side. So how do you use it? You apply the ultrasound gel, which is a conductive gel over the penis. This has a thickness about 3 to 5 millimeter. You push the handle clockwise and you insert the penis all the way into the ring. You have here the buttons for the power, the energy, and the first stage is you're gonna treat the external part of the penis. So you're gonna press the power button and you select your desired output level, and you can change it by pressing the plus button. And based on the energy button, you're gonna start the treatment and double click on the energy button to lock the function. The white RF light indicates that it's starting, and you start from the penis base, and the white light is off for at least 3 seconds or after, and then you treat for 30 seconds. If the white radiofrequency light is off, you can see here, once there's no more space to move forward, you're gonna go back to the base of the penis, and you're gonna start going back in increments along the shaft of the penis, and you're gonna do that for 15 minutes. The second stage, you're gonna use the ring with the pad that you can see here, and now we're gonna be focusing more on the crura of the penis. So the patient's gonna sit on the pad, which is gonna be placed between the scrotum and the anus, and then again, you're gonna do the same thing. You're gonna start from the base of the penis and make your way forward for at least 3 seconds. At the end of the treatment, you're gonna press and hold the power button for 3 seconds to turn it off. This device is waterproof, so you can clean the device after treatment with water without any issue. And it's a very easy device for patients to use. Ergonomically, it's easy to use, and the pad is very easy for patients to sit on, so there is really no discomfort with it. So when we look at the clinical trials, again, Elon and the group in Israel did the pilot study, so we wanted to validate this in a randomized controlled trial. So we have 6 sites, the primary site being at the University of California, Irvine, San Diego Sexual Medicine with Erwin Goldstein and Sue Goldstein, Optimal Health in Miami, Rachel Rubin, MD, in the Washington area, the Cleveland Clinic, Ohio, and Baylor College of Medicine with Mohit Kara. So the efficacy objectives of the trial primarily were to evaluate the safety and efficacy. So the co-primary endpoints were ED, looking at the IEF-EF scores at 3 and 6 months, and the secondary endpoints were looking at the erection hardness score or the EHS at 3 and 6 months, the EDIT scores at 3 and 6 months, the SHIM scores at 6 months, SEP questions and 8 at 12 weeks, and importantly, the usability of the Vertica device. And here you can see, for example, a flyer of the study as conducted at University of California, Irvine. So again, safety comes first. So what are our safety objectives? We want to compare the incidence, safety, and causality of all adverse events. So the number of grade 3 or more adverse events based on the CTE-CAE. So the changes in urinary function using the IPSS questionnaire were used, and the comparison of adverse events was included and reported as adverse events occurring throughout the 6 months safety evaluation. So the study design, the population where we recruited outpatient adult men more than 22 years of age with mild to moderate ED, this was reflected by the IEF-EF score. The study was designed as a randomized, controlled, prospective 6 months double-blind study. And the concurrent control was a sham device with a non-therapeutic, lower-level, ineffective, and superficially dispersed RF energy, which will be used in the control group. And like I said, this was double-blinded. The study will be conducted for approximately 10 months until all patients are enrolled and followed up in the study. And the main study objectives, again, are safety and efficacy of the Vertica device. So we collected demographic data, medical history, concomitant medications, and baseline clinical examinations. We did follow-ups at 1, 2, 3, and 6 months. And the treatment schedule was 3 times per week for 4 weeks, which is 12 treatments. Then 2 times per week for an additional 4 weeks, which was 8 treatments. And 1 to 2 times per week for another additional 4 months. Patients were instructed to attempt sexual activity at least once a week or 6 times per month and complete an event log using the validated SEP questionnaire. So the treatments were for a total of 30 minutes per session. The ring method, basically on the external part of the penis, was for 15 minutes. And the ring plus pad, which is basically delivering the energy to the perineum and the crura of the penis, was for another 15 minutes. Sexual activity was required at least once per week or 6 times per month so we can collect SEP questionnaire data. Here's the study timeline again. Baseline, IEF-EF, EHS, IPSS, and SHIM. First month, like I said, the treatments were 3 times per week for 4 weeks, and we followed up on the questionnaires. Months 2, patients were doing it 2 times per week for 4 weeks. Again, we were collecting questionnaires. Then months 3 to 6, they were doing 1 to 2 times per week for 4 months. And the end of the trial was at 6 months, at which point we again collected IEF-EF, EDITs, EHS, IPSS, SHIM, and SEP questionnaires. Inclusion criteria included all adult heterosexual males between the age of 22 and 85. The subjects were diagnosed with organic ED for at least 3 months. They had an IEF-EF score between 11 and 21, steady relationships for at least 3 months, and subject had to be sexually active for at least once a week or at least 6 times per month. And subjects were willing to sign informed consent and follow study protocol. And subject had a smartphone for us to be able to collect data. The exclusion criteria is a little bit exhaustive here, but essentially castrate or late onset hypogonadism. We didn't want everybody had to have normal testosterone levels, history of priapism, Peyronie's disease, radiation to the pelvic region, anatomic penile deformities or penile prostheses, Peyronie's disease, previous whole gland treatment of the prostate, history of unilateral urothelial or colorectal cancer, evidence of neurogenic bladder or use of catheter, subjects who are taking anticoagulants or antiplatelet or antiandrogen therapy, history of psychiatric disorders, premature ejaculation, and drug or alcohol abuse, subjects who are cognitively challenged or incarcerated, a pregnant partner, or serious heart, lung, or neurological disease. Concomitant therapy, and this was important in this study, was allowed as long as the patients were on a stable dose for at least 6 months and there were no dose or medication changes throughout the study. Here are the 3 study phases. First, we did a pre-study screening and baseline procedures. Then we did the initial treatment session and usability and tolerability assessment, which we'll discuss. And then the home use device treatments and follow-up assessments were conducted. And here you can see in the pre-study, we interviewed the patients. We made sure that they were eligible. We did a physical examination, including an examination of the genitalia. And we did some selective laboratory tests, which we'll be looking at down the road, such as some chemistry levels, PSA, and testosterone levels. The baseline questionnaires included the IFEF, SHIM, IPSS, and EHS. And the initial treatment was done in the clinic. So the patient received the device user manual, a training video, and a quick guide without any guidance. And following his self-training sessions, we allowed the patients to try using the device by themselves. The study coordinator was introduced to observe the visibility, the ability of the patient to do it by themselves. And then the Vertica app was installed to monitor the home use of the device. The follow-ups, like we said, were at 1, 2, 3, and 6 months. And they were, at the first week, a phone call was done by our coordinators to make sure that if the patients had any questions. And again, we collected physical exams, questionnaires, side effects, compliance, and logs. We discussed risks, including possible bruising or itching, penile edema, urethral stricture or trauma, hematuria, UTIs, nerve and vessel damage, or worsening erections. Precautionary actions were looked at: full control of the energy levels, whether the initial treatment session was conducted in the clinic, critical organs such as the prostate were far from the device, inactive RF probes were at the 6 and 12 locations, so the energy was only delivered to the corpora, not to the neurovascular bundle or the urethra. Thermal sensors were situated in each electrode, and in a preliminary study that was conducted with Elon in Israel, there were no adverse events, and a circular movement of the parallel electrodes such that the skin is only briefly exposed to the radiofrequency, and that the penis was covered with a water-based gel during the entire study treatment that is provided in the kit by the company. Again, the benefits: no needles, no anesthesia, easy to apply the gel, no PDE5 inhibitors, it's a home use device, it can be used for rehab, and there's no need for aid before sexual activity. In conclusion, with the radiofrequency device, normal spontaneous erections may come back. You may restore spontaneous sexual activity and not be subjected to injections or the side effect of PDE5 inhibitors. It is a self-treatment device that can be used at home. There are no side effects to this point. We are adhering to the concept of enhancing and improving erectile function, non-on-demand treatment. And this is the first radiofrequency device that uses technology to improve ED. Now, the device that we've been discussing all along and that we're presenting to the FDA for approval in the United States is a handheld device for the patient at home. I encourage you to go to the booth, which is booth 33, down the lane to the right, where you'll find Daniel, the rest of the team from Vertica or OMED, who will also show you the VerticaPro device, which is a device that can be purchased for the office, where the patient can receive the treatments in the clinic, and then once they're done with the treatments in the clinic, the patients will take their own smaller handheld device with a cartridge, and they can do their treatments at home. So it can be a device that is either directly purchased by the patient online and without a prescription, and they do their own treatments at home, or it can be done in the clinic under supervision, and then once they're done, they do maintenance at home with a handheld device. And again, I know we only have a few minutes left, but I'm happy to take any questions about the device. I'll just put an FY that this device is not commercially available in the US yet. It is commercially available in Israel and in the UK, for example. So if you have any questions about who is the eligible patient, how to recommend it to patients, these gentlemen are better suited than I am. I'm happy to answer any questions related to the clinical trial. Don and Elon, who are the patients in your practice that you are recommending the Vertica device to? I'll give you that question, Don. And Elon, I'll ask you, what kind of reporting do you get from a very kind of subjective perspective from patients and their partners regarding the device?
Maybe I'll start off then. So often patients that request this device, they want to try something new and something different, and something that actually treats the underlying cause. Can this reverse my erectile dysfunction? Because they don't want to take pills all the time, and often they, even with the PDE5 inhibitors, it's easy to take, but they get flushing. They don't feel like it's spontaneous for them. So those are the men I direct particularly to the Vertica, noting that obviously within the NHS, treatments are offered free. So there's a bit of a slightly different skew that we use. But despite that, men are still asking for this device.
Well, thank you for the question about the subjective responses. I think I'm the only one who did shockwave therapy investigation and radiofrequency. And there is a big difference in the subjective response because they are amazed. They feel that something's happening. They feel the engorgement. They understand that it's improving. The morning erections that they report, the improvement in erectile function so quick was a totally different impression that I got when using the radiofrequency therapy.
I have one more question for both of you. If you have a patient who comes in, I'm in an academic practice. I do a lot of duplexes. I get patients with venous leakage. Sometimes they're younger. They can be in their 40s, their 50s. They have venous leakage. These are very complicated patients. They have to use constriction rings, vacuum devices that are, especially if they're single, there's a big problem for them. Or you start recommending a penile implant, which can be invasive. How has been your experience in patients with venous leakage, giving them the Vertica device or offering them that as a therapy?
Well, because we were looking for these patients, because we had this theory about remodeling of the tunica, and we wanted to know if this is if we can establish this. So we had a bunch of patients coming in, having their Doppler done, and measuring their diastolic velocity, and 100% of these are few. There were 5 patients. 100% of them improved quite quickly just by this therapy.
Yeah, I would certainly echo this. I think they're the perfect candidates for this device. And also, in the UK, we're actually starting a study looking at the use of Vertica and penile rehabilitation after radical prostatectomy. So I think there are other potential benefits. Obviously, we need to do the studies, but promising things that may be coming in the horizon. So something to look forward to.
And Don, it's almost like you gave me a segue, but the last comment I'll make is that the potential applications of the Vertica device may be beyond just erectile function in the terms of allowing patients to have a recovery of their erectile function and spontaneous erections. There may be some potential benefits down the road for rehabilitation after prostate cancer or pelvic surgery. There may be some potential benefits in the setting of Peyronie's disease, which we're going to be looking at. We've noticed anecdotally in the initial trials, I can't talk about the FDA trial, but the initial Israeli trials, that the IPSS scores improved. So there may be some potential improvement in LUTS, maybe even in patients with chronic pelvic pain syndrome or CPPS, hashtag chronic prostatitis. So potentially in the future, there may be some added benefits in the urological or men's health world with the use of the Vertica device. Again, we're a little bit over time. I thank you all for attending, and please go to Boost 33. Thank you.
Thank you.